Hello, everyone. We're so privileged, so blessed to have our CSO, Rick Deitch, our biochemist on. He's answering questions for us on our brand new products. And we're going to start with Cindy. Cindy, if you'd unmute, go ahead and ask Rick your question and then mute back up, please.
Sure. Hi, Rick. First, I'd like to thank you so much for the original ZMunity. It helped my then 13-year-old, 9-month-old dog go from a walnut-sized mast cell sarcoma to a pea-size wrapped in fatty tissue sarcoma in 3.5 weeks. She is now 14 years old and 6 months and bright-eyed, bushy tail, and doing great. So my question today, because she has 21 allergies and saffron, it would not be safe for her. Is there an option to possibly introduce the old ZMunity as a pet ZMunity, or would there be an option to purchase the old ZMunity for pets in some way?
That's definitely going to be a Neil question. I will tell you this, that we didn't time it properly. We do have a few hundred bottles left of the old ZMunity. We weren't going to offer those. We just didn't want to confuse people. But certainly, I'm happy to get you some of the old ZMunity for your dog. But let me talk to Neil about that, about ZMunity for dogs. It's a good question, and I will follow up.
Thank you so much.
Okay, and we'll keep them as short as possible. Good job, Cindy. Tara, go ahead and unmute, and then we'll go to Star.
All right. Thanks again, Rick. These sound amazing. Is it best to take these products with food or not? Like 20, 30 minutes before the meal, or what's the best way to go about that? Thank you.
All of our products can be taken with or without food. I will tell you that the Plus Motion is a big dose of stuff. It's probably, some people might have stomach upset if they take it on an empty stomach. It's a lot to absorb. So I would recommend with the Plus Motion, have something in your stomach or eat a little something. It's going to absorb better. All right, good question. Thank you.
Great. Marcia Yeager? Oh, sorry. I'm sorry. Hold on just a second. Star, go ahead, sweetheart. I apologize. Can you unmute? You're not unmuted yet, sweetie. You unmute. You unmute and just stay unmuted and be quiet. Go ahead and work on unmuting. Marcia, go ahead and then we'll go back to Star. Thanks, sweetie.
Okay. Great, Rick. I really appreciate it.
There we go. Got it.
Okay, hang on, Star. Just a sec. Go ahead, Marcia.
Okay. My question is, Rick, I have bone on bone. I've had it for many, many years. All the doctors want to do a complete knee replacement. I don't have any inflammation. I don't have any pain, but you can see the arthritis sticking out. My knee's kind of bowed because of the bone has just kind of wrecked my structure. And I am limited to some things. It just doesn't bend. It's totally locked. Do you think that this could help grow cartilage? Do you think that's a possibility? I may get some cartilage back?
Yeah, so the way it works with the bursum meniscus, as long as you haven't scraped it clean, like gone and gotten a knee replacement, then yes, by definition, you still have a capsule. The fact that you don't have inflammation tells me that you still have a capsule around the joint. So yes, I think taking this product will spur the growth, and we should see improved spacing. Like I said, probably you'll take a little longer, but certainly within 3 months.
Yeah, I'm really looking forward to doing it and then getting some x-rays in about 4 to 6 months. So it'll be a great test. Thanks.
Yeah, send me those x-rays. You're going to see improved spacing, and your doctor's going to say, "What are you doing?"
Thank you.
I'm going to try to be fair. I'm going to go all the way through Harriet with raised hands. After that, we're going to the chat. So if any raised hands go, you'll have to wait till after chat. So Gayla, go ahead.
Yeah, I might be reiterating what the last lady just asked, but I've actually been doctoring with a knee meniscus tear from February. Went in, it's not till April because I was avoiding aggressive surgery. They did the cleanup only and then found major arthritis. And now the arthritis it's like aggravated. It's grown. It's like put it on turbo speed to where now he said what he calls it jumped me up a level, which I think he's talking about towards knee replacement. He's trying, and I just finished 3 gel injections of the hyaluronic acid you're talking about. They can't get that arthritis to calm down and stop being angry, and it keeps tearing my meniscus. So my question is, how is this going to relate to helping that? Or I can't hardly bend my leg because there's so much tightness in it. How's this going to relate to all the
Yeah, I mean,
meniscus
yeah.
building and calming the arthritis and stuff?
So I already talked about inflammation, and I talked about the capsule, the synovial fluid, and the cartilage, and basically the collagen, type 2 collagen that builds the cartilage. Meniscus and bursa are just two other forms. Meniscus is the skin, basically the membrane that surrounds the capsule. And so it tears and heals and tears and heals. So meniscus heals and bursa heals, which is also a collagen. So both of those are actually healed with glucosamine. It's clinically proven that glucosamine will restore cartilage, bursa, meniscus. So that alone would do it over time.
5.
Okay, sorry
Yeah,
about that.
yeah.
Were you
Yeah,
done with that
Star,
one?
Star will
ahead.
be, yeah, let me just finish. So even though, we kind of, rheumatologists will tell you all the different levels that are damaged in arthritis, all of these are benefited, it just with glucosamine. So I can only assume that with all these other ingredients, with what the Plus Motion brings to the table, you're going to see really good benefits as you preserve the capsule and then get that lubrication back in and then start to replenish the joint. So yeah, I think it's going to help. It might take you a little longer because of the damage that's there, but you got to give it a couple of months and see how you feel. Okay.
Good.
All right,
Star,
Star's
sorry
next.
about that. Star, you're up, sweetheart. Thanks.
Okay,
Sorry.
thank you. What about someone who has had hip replacement? Will this help them, especially since they're in pain?
So it's a little tricky. Once you actually have a replacement, they damage the capsule to put in a new bone, new joint, and basically artificial cushioning. There's no cartilage left to regrow in a hip replacement. In that case, certainly the tendons around it still need to be preserved. So I think this will help. I will tell you this: if they had one hip replaced, the other hip is going. Okay, so certainly you want to preserve what's left. So the Plus Motion will help. And then for the pain and inflammation, the Plus Relief should work wonders. So with that sort of pain, I would use both products.
Thank you.
Hey,
My
Mary
pleasure.
Jane, if you want to go next.
Yes, I can't remember, sorry, Rick, which product has is it sulfates or something in it? I'm not sure because I have a friend who is allergic to sulfa drugs and I didn't know it's probably not the same sort of
No, it's not. Sulfa
product,
drugs are a compound, a cyclic compound with sulfur in it. They were some of the original antibiotics. And yes, a lot of people are allergic to sulfa drugs, which is not sulfur. Sulfur as a atom, as a molecule, is in every cell in our body. So you can't be just allergic to sulfur. So MSM is not a sulfa drug. It's a methylating agent, a sulfur donor for cartilage growth. So I don't think I've never met anyone that's allergic to MSM.
Great,
Okay.
thank you.
Hey, Jennifer, you're
pleasure.
next, please.
Hi, how are you guys?
Fabulous.
Thank you. I'm glad, Rick. So I've been going through some health issues with my feet, my knees, and my liver. And I'm wondering, would either one of these things help? I go to see a specialist on September 5th for my liver.
Well,
And was
certainly for
wondering if
liver
it would help.
support, yeah. For liver support, I'd recommend the Plus Balance. The Plus Balance is made to support liver function. That's all.
Okay.
And with that liver function improvement, people are seeing, more energy. They're seeing healthier hair, skin, nails, walls or blood vessels, hormone balancing, just helping the liver improve. So the Plus Balance has been a miracle product for a lot of people. So that's why I recommend for the liver. Then if that's the problem and liver toxemia is what's causing your problems with your legs and feet, then certainly that's going to help. If you had another diagnosis, then we talk about how else we can help you.
Okay. Thank you, Rick. I appreciate you.
My pleasure.
Just a note, we have a lot of chats. We'll get to them in a minute, but I am stopping at Jonesy, possibly. So just so you know, guys, that's quite a few chats for him to answer. He'll go as fast as he can, but we'll do the best we can.
I talk really fast.
He does. Maria, you're on next.
Hello, I was just wondering because you know how my daughter has the autoimmune this thing
Yes.
going on. Would she be able to take it because she will have eventually? They have said the arthritis in her bones. The what is it called? Because she's a youth. She's only 11. So would she be able to take that as well?
Yeah, there shouldn't be any issue. There's nothing there that would be contraindicated with autoimmunity.
Okay.
Okay?
Thank you.
My pleasure.
Lisa, go ahead.
Hi, how are you?
Good.
My boyfriend has an overactive immune, as the lady before said, autoimmune. And his knees, and he's been taking quite a bit of the prednisone. Will
Yeah.
this help him? I mean, his knees and ankles and they swell so bad where he can't even walk.
Yeah. So is he diagnosed with rheumatoid arthritis?
No,
No? Could you know what the diagnosis is?
it's just an autoimmune. Tell
Yeah.
me what it is.
His body attacks itself.
His body attacks
Well, yeah,
itself.
that's all autoimmune disease. There's thousands of them. I was just curious because what happens in autoimmunity is your body mistakes healthy tissue for enemies. So in rheumatoid arthritis, for example, your body thinks your joints and connective tissue are a foreign body and attacks it. In MS, your body thinks your nerves are foreign and attacks the nerves. So if I know which autoimmune disease it is, I can kind of tell you how it will work. But regardless of what it is, this is going to help preserve cartilage, rebuild cartilage, and rebuild flexibility and lubrication in the joints. So I know that's going to help. If you know more about the disease itself, you can reach back out to me. All of our emails at Avini are first name at avinihealth.com. So RIK at avinihealth.com, or write to support because I've answered a lot of these questions. I'd be happy to walk you through that particular disease.
Thank you.
Okay?
I'll take
My
the
pleasure.
3 more hands on that, Rick, and then I'm gonna let you go for the chat because you go faster without me. So Harriet,
Okay.
and then Kathy, and then Mark, and then we'll go to the chat. So Harriet, go ahead.
Right. Really impressed with the ingredients. However, I have a daughter who is going on 50 years old and she's a vegan. Would you have any kind of product that could help with the joints for someone who's a vegan?
Not really. I mean, even the plus relief is cobra venom, and I don't know if a vegan would use cobra venom. I believe everything we need comes from nature, including animals. So, so yeah, this is if she won't use things that come from animals, then this particular product with a plus motion, you got the Colavant N2 comes from chicken sternum, the Celadrin, the acetylmyristoliate comes from cows. But just so you know, no cows were harmed. You don't have to hurt a cow to get the Celadrin. It's kind of like milking, you know. And then of course glucosamine comes from shellfish, but this is just the glucosamine from shellfish. So there's no shellfish allergen warnings with our glucosamine. But no, we don't have if she's vegan, she can't use anything from animal products. We don't have that. I apologize.
I understand. I was just hoping that maybe even a smaller, like a less ingredient type version with hyaluronic acid that's not from animals, or if there were a possibility.
Yeah,
For the
again,
future.
we have the sources that were used clinically, and that's what I need to use in my product so we can make the strongest claims possible. All right. All right, Robin, where are we?
Kathy, go for it.
Chats? Okay.
I've already had tremendous experience with the plus motion, but what question I have is, after I got home yesterday, I gave my husband one of the new ZMunity and then one this morning, and he has had some kind of some psychological reaction or something. And so my concern is we're not going to have the old ZMunity available to us. Is that correct?
Yeah, we made the decision not to have 2 versions. We just have the with saffron. I mean, like I said, the Afron is clinically proven in over 3,000 patients, and we haven't seen anything. Is he on antipsychotics or anything like that, or
No?
What
Yeah.
happened? Did you just get really, really happy?
No.
No?
He was, uh, uh, I don't, this is too, we don't have time for me to go into it.
All right. Well, there's no such thing as a bad question. So I'm just kind of curious
Yeah.
what you think happened and see, because it could just be he's got to get used to it. So it's smaller doses, maybe one every 2 days, one every 3 days, and let the
Right.
chemistry work itself out.
Yeah, I thought
Yeah.
of that. So
Yeah.
I'm probably going to be doing that.
Okay.
All right.
Beautiful.
Thank you.
Mark, go ahead.
Thank you, Robin. Hi, Rick. Back in 2021, I dealt with stage 4 cancer, and I did go through 6 rounds of chemo. And as a result, I mean, I'm still alive, which is the most
You can
important
tell.
thing. But
Yeah.
from the tip of my toes all the way up to the middle of my back, and my knee is the worst portion. My knee, some days, I have great difficulty even walking, and it just varies from day to day. My right calf is very, very tight. I'm able to walk, and unless people who know me know that I have issues doing that. What are your thoughts on that?
Were you on a platinum-based chemotherapy?
No.
No, okay, because that leads to neurologic damage. So that's what we'd see. So I don't know exactly what your damage would have been. We could do a deep dive and see what chemotherapy you were on, what treatment you had. So
It was
is your
Taxotere.
tax okay? I actually worked I worked with Monroe Wall at Duke University when he created Taxol, Taxotere. So I worked in, and then I worked with Gertrude Elion when we worked on camptothecin analogs. Yeah, Taxotere actually binds to tubules and prevents cell division, and it can cause mild rhabdomyolysis or muscle loss, which is probably what you had, some mild muscle loss in your legs. So I'd recommend the Plus Motion. It's going to help with joint and flexibility. The Plus Relief for pain and inflammation. I don't know if you've been using the Plus Relief. Have you had a
I
chance to
have.
try it?
Yeah, I have.
So yeah, we even have we work with Dr. Mitch Gann, the oncologist here in Boca. He gives it to all of his cancer patients for deep visceral pain, and he has incredible results. Sometimes you have to spike the dose, take a lot more until you feel relief, and then back off. Okay. And then lastly, believe it or not, I'd recommend the meal replacement. It's 22 grams of really good protein with the aminogen. It's going to help rebuild your lean muscle mass. I think you do have some loss of muscle mass from the Taxotere. Okay.
Okay. Great. Thank you.
And I
My
apologize,
pleasure.
but there was a Lisa Marks on here and then dropped off, and I forgot to ask, and she came back. Are you still there, Lisa? Real quick. If not, Rick, you're released to the chats, and I looked at the chats a while ago when there was 20, so down to
Yes,
0.
I'm here.
Oh, are you there, Lisa?
Okay.
Go ahead,
Yeah.
sweetheart. Sorry, we missed
Oh,
you.
no, I already asked my question.
You great. Okay, perfect. Thank you,
Okay.
sweetheart.
Yeah, I
Thank
thought I
you.
recognized her.
Okay,
Okay.
thanks,
Yeah.
Rick. Yeah, Rick's got the brilliant mind here. I was the blonde one. Okay, so Rick, down to there was about 20 chats, Jonesy, and I kind of so you only have, it's like 10 minutes. So you go as long as you want, but we want to let you go when you need to, okay?
Okay, I'll start calling. So the first one says, can new ZMU replace the cardio supplement? No, they're completely different in every possible way. The new ZMunity is for immune support, and now it's mood enhancement, mood elevation, antidepressant. The Plus Cardio Care basically rebuilds your cardiovascular system. It supports your heart as a muscle. It helps regulate heart rate and rhythm. It clears the large arteries around the heart. It clears the small arteries around your body. It relaxes your arteries for blood pressure support. It's a completely different product. So one does not replace the other. Can I use it for my dogs? We kind of talked about this before. I really need to look and see what these could do for dogs. Believe it or not, there are antidepressants for dogs, and they are in that family, that SSRI family. So I'm going to see if we can use this immunity for dogs. And similarly, people ask me about the Plus Motion. Now, there is a dog supplement called Cosequin, which is glucosamine and quercetin and some other stuff. But I want to make sure that none of the other ingredients will be bad for a dog or a cat. So that's something I'm looking into, and I will have an answer by next week about what can and can't be used in pets. Chip says blue zone. I don't know what that means.
So what I'm talking about, Rick,
Yeah.
the piedide region, when you move in, you get the benefit. When you move out, you lose the benefit. Concept for everybody to use with all Avini products, especially ZMunity, is that you can now pick up the blue zone and take it with you. Avini is a traveling blue zone. That's what I wanted.
I like it. Thanks, Chip. Chip Litterdine, everybody. Okay. Um, and then can someone sulfur allergy? So I was really clear. People don't have sulfur allergies, they have sulfa allergies. Sulfa is a class of antibiotics that a lot of people are allergic to. So yes, I've never heard of anyone allergic to MSM. It's safe to take the crisis dose you with Aphrodite. Yes, it is. It needs a very small dose to be effective, but there's no upper limit where people could be hurt. Remember, saffron is in essence a spice. I'm sure people put a lot of saffron on their food, although it is a very expensive spice. So yes, you can take a higher amount, and that's fine. Again, plus motion for dogs. I already answered that. I have a question about the sources of the mushroom and the saffron. Well, saffron comes from Greece. It's a natural extract of the stigma of the plant. And the mushrooms, I've talked about this before, our mushrooms are grown in competition with each other in a cave system in Carson, Nevada. So there, it is a U.S. source. It is highly controlled. It's a 3 miles of caves in Carson, Nevada, that they grow all these mushrooms against each other. I have a vegan client with bone on bone knee motions, but okay, yeah. So I think I talked about this before. Listen, most people are vegans not for health. It's because they care about animals, and I really appreciate that. But there's a lot of drugs, a lot of dietary supplements that come from animal sources, and there is no other source of some of these components. So even if they have to see, they will benefit from this. And I think about Avatar. If you ever saw the movie Avatar, and they kill their prey, and then they thank the prey for donating themselves to their meal. So it is what it is. The only way we can get some of these ingredients is from animals. So if you're just devout vegan, then you're not going to be able to use these with some of these. Let's see. Years ago, I tried glucose for my knees. It upset my stomach. Now, when I took it with food or without, is the HCl version easier on the stomach? Well, there's very few products that are just glucosamine, and it is a big dose. I do recommend taking it with food. Glucosamine HCl is a little easier to digest because it has acid in it that goes into your stomach and helps digest it. And it's a little lower dose because it doesn't have that extra sulfate. So as I said, it's 83% glucosamine and then only 17% HCl. So I don't know anyone that really has those issues with it. And certainly we have the other components that are going to improve its efficacy. Will the plus motion help people with rheumatoid arthritis stop attacking healthy cells? So it's a little tricky. With dietary supplements, we can talk about improving a healthy system. We can't talk about treating disease. Rheumatoid arthritis is arthritis. But instead of just natural degradation of the joints and connective tissue, it's an autoimmune attack on the joints and connective tissue. So yes, the plus motion will help. It'll help preserve the joints. It'll help rebuild the cartilage and connective tissue. It will not stop your immune system from attacking your joints and connective tissue. So we do have other products that are naturally immunomodulatory, primarily the ZMunity and the Cell Defender. So they help modulate immune response. They're both clinically proven to prevent a hyperimmune response. So I would tell anyone with rheumatoid arthritis, monitor their SED rate, their ANA, their C-reactive protein with blood work, and take the ZMunity and the Cell Defender, and now the plus motion. Let's see. I'm looking forward to a hip replacement. Complicated spinal surgery, including sacroiliac joint surgery. What dosage do you recommend? I gotta tell you, the 2 twice a day is a great dose. It's the clinical dose. And it's kind of funny that you guys immediately jump to, can I double it? Can I triple it? Can I quadruple it? And it's wonderful. You guys all want to jump in. I will tell you that the 2 twice a day is a clinical dose. If you want to take a little more, it certainly can't hurt you. I don't know how much more benefit it would be because that has not been tested. But like I said, we've seen people just taking as recommended have an almost immediate response, certainly within 24 hours. So I would start with the recommended dose and see how you feel. So is bone spine injury. I already talked about this. Disc disease will plus motion help. Yes. If you have bone on bone, you still have a capsule. You still have the ability to regrow that cartilage at the bone and improve the tendon health. So yes, even if you have bone on bone, it can help. Now, I said this before, if you have an artificial hip, they've removed all of that. They removed the burst of the cartilage and meniscus and put in artificial. It's not going to help that, but it'll help all the rest of the joints. Because anybody that tells me they had one knee replacement, the other knee's about to go. Anyone that had one hip replacement, the other hip's about to go. That's what happens. It's very symmetrical. So you still want to keep taking this stuff to improve the health of the joints you still have and improve inflammation, will reduce inflammation on the joint that you had replaced. I don't have any cartilage, bone on bone. Okay, so same thing. I did the same thing. Could it be possible that I could grow cartilage? Yes, it is possible you can grow cartilage. Is the info on the level of triterpenoids and polysaccharides? Are these whole mushrooms, fruiting body, or mycelium, hot water, or alcohol? Okay, yeah. So yes, these are whole body. Okay, mushrooms, whole mushroom extracts, and they are hot water extracts. They are also no pesticides or herbicides. These are grown in a controlled environment. So a lot of other things that you can find with either natural mushrooms or lab grown mushrooms. We don't have any of those issues with this product. The IAS, the Immunosys Supreme, has over 30 publications on it. It's been well tested. I've been using it for over 30 years. Yes, it's fabulous mushroom extract. Can this help with severe crippling arthritis, degenerative disc disease, someone who can hardly walk or stand as possible and is too far gone? You're never too far gone. You can always start to improve. I will tell you this, if it's severe pain and inflammation, I would use the plus relief with the plus motion. Because the plus relief is anti-inflammatory, it's analgesic. I've talked about the plus relief. If anyone really wants to do a deep dive, I did a 1-hour masterclass on the plus relief that's available at Avini Health Training. But the peptide actually goes to the brain and tells the brain to stop thinking about pain in the parafascicular nucleus. So I'd certainly say if you have this sort of pain, you want to take the plus relief along with the plus motion. How about dividing this the plus motion to have 2 capsules or more twice a day? Well, it is 2 capsules twice a day. So Richard, yeah, so it's 2 capsules twice a day. If you want to take more, take 2 capsules 3 times a day, breakfast, lunch, and dinner. Can it be taken with diabetic medication? Yes. There's no contraindications with the plus motion and diabetic medication. When can we get the fabulous short product video to forward to prospects? Oh yeah, Neil already answered that one. Yeah, so Neil, myself, and Mickey came 4 days before conference and recorded a ton of videos. So we're editing it all out. So it's a lot of content that we're going to add to the website and to the app. So you guys have a ton of video to be able to share with people. What provolone do you suggest for degenerative discs? I'm sure that's a typo. Robin, it says provolone.
I'm hoping they mean product.
I meant protocol.
Protocol. Okay. Because provolone is a cheese.
Okay.
Okay. What protocol? The exact protocol that I already talked about, 2 twice a day is plenty. With the degenerative disc, you can use the plus relief oral spray and topical gel. That'll help cushion everything. It'll help relieve pain and inflammation. See BPC getting synthetic.
So we're almost to the end of those 20, Rick, and it is a little after 6. And Rick has been through with the whole corporate. Rick, it's up to you if you want to take a couple more, but I think we better let you go here really quick. Okay, I'm just freeing you.
Let me just see what I got here. A lot of them are repeats, So someone asked me to compare with BPC 157. I don't know what that is. So I'm gonna have to look at that. If someone wants to send it to me in an email, or Robin, or if they want to just send it to support, I can answer it on email. Herniated disc, I already talked about that. Myophasia pain syndrome. Well, myophasia is not loss of cartilage, it's neurologic. So that would be definitely the plus relief. And believe it or not, mind and vision might help because it's neurotransmitters. What ingredient is that rheumatoid arthritis doctor will most recognize? Well, I mean, they're all going to know glucosamine. They're all going to know hyaluronic acid. They're all going to know MSM. Some of them might know acetylmyrstolate, the Celadrin, but the Colavit N2 and the Tendaxion are brand new ingredients just in the last year, although they have been studied over the last 10 years. So there's a lot of people that aren't going to recognize those ingredients, especially with the others in the formulation. My son has MS. Will it help? Certainly, the MS is autoimmune. It's neurologic. What I recommend for MS is the Plus Relief. The Plus Relief is naturally immunomodulatory and anti-inflammatory. Additionally, MS patients, because they're not getting good signaling, neurotransmitters help a lot. So I recommend Plus Mind and Vision. That gives you neurotransmitters to allow for better nerve transmission. And then lastly, because it's autoimmune, I recommend the ZMunity because ZMunity modulates the immune system health and prevents a hyperimmune response. So that's what I normally recommend for MS. Let's see. Can pets take through? I already said that. Myofascial pain, mild chronic prostatitis. Prostatitis inflammation. So I still recommend the Plus Relief for generalized inflammation, not for joint support, and the Plus Balance because Plus Balance helps balance hormone levels, reducing cyclic testosterone, but also balancing all that stuff. It's clinically proven to prevent prostate, and the ingredients are clinically proven to prevent prostate and testicular cancer in men, breast, uterine, cervical, and uterine cancer in women. Ehlers-Danlos. So Ehlers-Danlos is a little different. It's hypomobility. I don't know. I would argue that it probably will help with Ehlers-Danlos syndrome. So if you know people with Ehlers-Danlos, let's generate some data. Let's get the product to them and see how it helps. So for people that don't know, Ehlers-Danlos syndrome, they have hypermobility, so their joints can be hyperflexible, and they can actually hurt themselves by hyperextending. Their arms, their knees, things like that. Let's see. All right, let's see. Would you need help with could you speak on the regulatory process with our products? Well, I mean, we are fully certified, fully GMP facility, good manufacturing practices. We have our in-house quality control. Every product made is made under GMP. Everyone wears their PPP. We do A, B, and C cleanings on every product that everything comes in. We test every raw material that comes in. Our vendors are only qualified vendors for those raw materials. We test all the raw materials and then we test the finished goods. We also keep retained, so we keep samples of every product we make. So we have it here. So if anyone at a later date says there's something wrong, I can pull up that lot exactly and test it and make sure it's okay. And then we do our own in-house testing. For people that took the tour here, you can see our lab. We've got microscopes, we've got incubators, we've got stability chambers, we've got spectrophotometers, centrifuges, 2 fume hoods, a biosafety cabinet, a particle size analyzer, spectrophotometers. So we have everything here to do our basic lab in-house, and then we also send it out for third-party testing. So yes, we have full soup to nuts, the same GMP certifications that you'd have if you were making pharmaceuticals. All right, I think I'll wrap it up with that, Robin.